Okay, guys. So we have to briefly talk about the types of ischemic stroke. All right. Briefly talk about the types of ischemic stroke. So it's just quite simple. We have embolic stroke, we have lacunar stroke, we have atherothrombotic stroke, and all of that. So just at least so that you guys know the like the definitions. All right. Embolus. I think that is simple. Embolus is like something from somewhere coming. All right. Maybe there was blood clot somewhere, so it escaped right to the brain. You understand? Then lacuna, atherothrombotic, right? We'll look at it. So embolic stroke is occurs when blood clots or debris, okay, forms away from the brain, commonly in the heart, and is swept through the bloodstream right to lodge in narrower blood vessels in the brain. So source of emboli include arterial fibrillation, maybe heart valve disease, heart attack, or infections in the heart, endocarditis. Other symptoms often have what there's a sudden onset because the clot travels quickly to the brain. Okay, lacunar stroke now. This is lacuna, plaque blocking stroke. Alright. Lacuna is caused by occlusion of small penetrating arteries that provide blood to deeper brain structures. So because they go deeper into the brain, they are much more smaller. Right? Location so that these strokes occur in areas such as basal ganglia, the thalamus, internal capsule, and the pons. So symptoms include there's a pure motor or sensory deficit. There's ataxic hemiparesis. Hemiparesis, that's what impaired motor control and weakness on that side. Then there's this atrial. So the person is really having a slurred speech. Okay. Then atherothrombotic stroke. Cause atherothrombotic, just like atherothrombotic is kind of like result from the formation of this there's a like a thrombus, that's blood clots within a large artery that supplies the brain. So pathophysiology is often due to atherosclerosis, which is a condition where fatty plaques build up on the walls of the arteries, causing them to now narrow and become prone to clot formation. Right. So onset symptoms can develop gradually as the artery becomes progressively narrowed or suddenly if the clot just completely blocks the artery. Okay. So that's it for these types of what? Stroke that will be due to blockage, right? But the different subtypes that we have in them.